Founder and producer Professor Ahmed Mamdouh El-Sharif, Professor of Epidemiology and Infectious Diseases of Animals, the ex-head of Department of Veterinary Medicine, the ex-vice dean of Faculty of Veterinary Medicine, Anusyuf University presents Technical Veterinary Learning Channel. Today we will speaking about an important subject in veterinary medicine, the diagnosis and differential diagnosis of diseases causing nervous disorders in large ruminants. The picture that appear here is a symptoms of BSE at the beginning of this disease in an infected cattle. This is a prominent nervous signs are present. In the following slides, we will discuss how we can diagnose and differential diagnose these nervous diseases, as well as differentiate it's coming from central nervous system infection or injuries, or it's coming from BNS or peripheral nervous system infectious or injuries.
Correlation between clinical findings and the location of lesion in the nervous system of farm animals by means abnormalities of the visual system, as we seen in this short video, that this calf is walking blinded in different manners and he not seen anything in front of him. So he is going round and round and round again. When the principal signs is blindness and the animal bumps into object during walking or running, secondary signs will be pupillary dilatation, and there is no pupillary light reflexes and no meniscus reflexes. The location of the lesion will be optic nerve, so we have to examine the fundus of the eye. The very clear examples or diseases affecting the animals at that time are vitamin A deficiency or pituitary rete, mirabile abscess, congenital retinal, dysplasia of goats. But when the primary sign will be peripheral blindness or night blindness, there is no secondary lesion, and location of the lesion will be retina, and the examples will be nutritional deficiency of vitamin A as a disease, or inherited deficit of apallosa in foals as a disease. When the principal sign is central blindness and secondary signs are pupil normal size, pupillary light reflexes is normal, the location of the lesion will be at cerebellar cortex, and the example of the diseases that may be noted, it will be polioencephalomyelitia and lead poisoning. When the principal sign is abnormal construction of pupil, meiosis, secondary signs are dyspnea and or diarrhea, location of the lesion will be failure to activate acetylcholine that transmitted the signal of nerves between the different nerve conduction, and the example of the lesion or disease will be organophosphorus poisoning. When the principal sign is abnormal construction of pupil, meiosis also, but the secondary signs are blindness, coma, semi-coma, spastic paralysis, the location of the lesion will be diffuse in the whole nerve system, and the examples is polioencephalomalacia and acute lead poisoning. When the principal sign is Horner syndrome, by means that dropping of upper eyelid, miosis, and enophthalmos, while secondary signs are hemilateral sweating and temperature, right side of face and upper neck, unilateral exophthalmos, nasal obstruction, the location of the lesion will be damage to cranial, thoracic, and cervical sympathetic trunk. The clear examples of lesions here will be mediastinal tumor, guttural pouch, mycosis, neoplastic, space-occupying lesions of the cranium involving the pre-orbit, pre-vascular injection around the jugular vein, or normal intravenous injection of xylazine hydrochloride in the normal horses, melanoma at the thoracic inlet of the horse. When the principal sign is abnormal position of eye pole and eyelids, and secondary signs are dorsomedial deviation of eye pole and eyelid, the location of the lesion will be trochlear. That means cranial nerve number 4 and facial cranial nerve number 7. The examples of the diseases are polioencephalomalacia or listeriosis. When the same principal sign, abnormal position of eye pole and eyelid, and secondary signs are ventrolateral fixation, the location of the lesion will be at oculomotor nerve, cranial nerve number 3. The examples are the same, polioencephalomalacia or listeriosis. When the principal signs are abnormal position of eye pole and eyelid, while the secondary signs are protrusion and medial deviation, the location of the lesion will be abundant at cranial nerve number 6. The examples are abscess, tumor, as in case of bovine viral leukosis. When the principal sign is no palpebral reflexes without any secondary signs, the location of the lesion will be deficit sensory branch of cranial nerve number 5, and the lesions here will be trauma of the nervous system or trauma of the eye. But when principal sign is absence of Menkes response without any secondary signs, we noted that location of the lesion is facial nerve provided vision is present. The examples that clear is listeriosis disease. When the principal sign is absence of pupillary light reflex without any secondary signs, and oculomotor provided vision is present. Also, the clear example will be also is listeriosis. Keep on the track for following me on the Technical Veterinary Learning channel to have the most newest information about all veterinary infectious diseases.